us. It takes Zoom just a minute or so to add everybody into the room, so please sit tight and we'll get started in just a few moments. Thanks so much. Thank you everyone for joining us. It takes Zoom about a minute or so to add everybody into the room, so we're just giving time for that to happen. Please sit tight and we'll get started in just a few moments. Thanks. Thanks everyone for joining us. Just sit tight for a few more moments while Zoom adds everybody into the room, and then we'll get started. Thanks. Okay, hopefully Zoom has had time to add everybody now. We will go ahead and get started. Thank you everyone for joining us. Welcome to the latest Duke Media briefing on the COVID-19 pandemic and its effects on society. I'm Gregory Phillips with Duke Communications, and I'll be moderating this event. In the several months since the pandemic reached the US, the accumulation of stress is taking a heavy toll on the mental and emotional well-being of millions of people. We have 4 Duke scholars with us today to discuss the effects of the crisis on mental health and ways to cope with the stress. I'll introduce our speakers and get the discussion started, then we'll then open up to questions. We are recording this briefing, and that recording will be sent to everyone who registered. Thanks to those reporters who already sent questions. During this discussion, those of you joining us on Zoom can submit questions via the Q&A window at any time. There will also be an opportunity to ask questions in person in a few minutes. Thanks also to everybody joining us on YouTube. With us today is Tim Strauman. He is a professor of psychology and neuroscience at Duke's Trinity College of Arts and Sciences. He studies how self-regulation affects vulnerability to depression and other disorders, plus the impact of treatments for depression. Good morning to you.
Good morning. Thanks for having me.
You are welcome. And we have Robin Gurwitch. She is a professor in psychiatry and behavioral sciences at the Duke University School of Medicine and director of parent-child interaction therapy at the Center for Child and Family Health. She studies the impact of trauma on children and families. Good morning to you.
Good morning, and thank you for having me too.
Thank you. And we have Anna Gassman-Pines. She is an associate professor of public policy, psychology, and neuroscience at the Sanford School of Public Policy at Duke, where she studies low-wage work and family life. She also works with the Center for Child and Family Policy. Good morning.
Good morning. Thank you so much for having me.
Welcome. And also joining us is Kyle Bourassa. He is a clinical psychology researcher and postdoctoral scholar at the Center for the Study of Aging and Human Development at the Duke University Medical Center. Good morning to you.
Good morning. Happy to be here.
Okay, right. We're going to jump right in here. Professor Strauman, I'd like to start with you. What are some of the mental health consequences and implications of COVID-19 as a causer of chronic stress that has no predictable end in sight?
Well, you've mentioned one of the sort of most toxic elements of it. I think there are 3 things that are affecting people very profoundly. One is a sense of frustration because we're stuck. We can't do the things we want to do, accomplish the goals we want to have. And I think you can see that manifested in a whole bunch of ways. The second is sort of the unpredictability. You know, we don't know when it's going to end. We don't know if it's going to, turn out to be, something terrific comes along tomorrow or if it's going to get worse. And the third one is the sense of uncontrollability. Like as an individual, there's nothing I can do about it. And the combination of those 3 things is a really toxic combination that leads people to feel depressed, hopeless, anxious, cynical, and angry. And I think you can see manifested in a whole variety of ways that this pandemic has worn on us as individuals and also as a society.
Thank you. Absolutely, and lots to dig into there. But for now, Professor Gassman-Pines, I'd like to move on to you. You have been surveying service workers with young children since just before the pandemic hit. What do your findings show about how the effects of the pandemic on emotional well-being has been over time these past few months?
Well, thank you so much for that question. We've been following a sample of hourly service workers with young children between the ages of 2 and 7, actually since last fall, well before this pandemic was even a glimmer in anyone's eye. And right when all of the initial restrictions were put into place, we saw declines in mental health, especially for parents. But in our most recent survey wave, which took place in June, as the pandemic had been wearing on at that point for 4 months, What we found is that families are both very economically strained as well as psychologically strained. And so in our sample, a full 50%, half of these parents are screening positive for serious depression or anxiety or both. Those are very high rates of mental health problems that I think reflect not only the unpredictability that Professor Straumann was talking about, but also for these economically vulnerable families, a substantial amount of economic strain.
Absolutely. Those are scary numbers, and we'll certainly be discussing that some more. For now, Dr. Bourassa, I'd like to move on to you. You study the impact of stress and trauma on health. I mean, are there realistic behavioral changes people can make right now to improve their health in such a time of stress?
Yeah, so there are a few different ways that stress can affect health, and each suggests different changes people could make to improve their health during what is an extremely stressful time. So in terms of the areas I study, there are three broad ways stress is thought to affect health. By changing our bodies directly, through changes to our health behaviors, and through changes to our social relationships. When it comes to directly affecting our bodies, stress can affect our physiology by doing things like increasing our blood pressure or heart rate, for example, that are tied to poor health over time. Stress can also affect health indirectly by changing behaviors related to health, so things like exercise, diet, and sleep, as well as our behaviors related to our social relationships. So the ways to improve health would include working to directly decrease your stress levels, as well as changing the health relevant behaviors that stress can impact. In terms of directly decreasing stress, there are techniques like mindfulness, exercise, and mental health treatment that have been shown to reduce people's stress over time. That can be very helpful for some people, but we do know from decades of research and intuitively, I think, that changing how we feel is hard. After all, wouldn't we all just get rid of our anxiety and stress if we could do that? So another useful option is focusing on our health behaviors and making sure that we're taking care of ourselves, however that might look. For some people, that might be cooking healthier meals. For others, it might be exercising or making sure they're getting enough quality sleep. These behaviors aren't really different than the things that keep us healthy when there isn't a pandemic going on, but it can be very easy to slip into unhealthy routines during periods of high stress. Finally, we know that strong social connections are linked to better health, but sadly, right now, many people are feeling socially disconnected. Efforts to spend time with others, however you might be able to do that safely, so digitally, on the phone, or in a physically distanced way, increasing your social connection to the people you care about has huge benefits to your mental and physical health as well.
Absolutely, thank you. And certainly lots more that I'd like to talk about there. But we'll move on now to Professor Gerwich. And there are millions of children now who, after months at home, are now either returning to school buildings amid all this uncertainty, or they're stuck at home taking classes online. And obviously that brings a lot of stresses that we don't necessarily think about as adults. What can parents and caregivers do to help their kids' mental and emotional health at a time like this when we're grappling with stuff ourselves?
Sure. I think parents are doing the best they can. And there's not anyone that doesn't say, gosh, it's good for children to be in school. But now you're balancing the safety concerns with the educational and social emotional concerns. So parents are truly put in a difficult position sometimes. And they're trying to balance their work. So it's almost like balancing a bunch of balls, and then somebody throws in live chainsaws, and now you've got to balance all of those too. So when we think about what parents can do for their children, it's important to recognize that probably one of the best predictors of how well your children are going to do is how well their parents are doing, how well their caregivers are doing. So if we can talk to parents about thinking what you can do for yourself, as has been mentioned, but also thinking about how you set up home. So do you have a routine that can help children, even as young as those 2-year-olds? Having a regular routine truly helps reduce anxiety to children. Routine including taking time to take a walk or do something fun or quiet, as well as homework time or Zoom time. We talk to parents about thinking through helping children feel like they can control something. So talking to them about, you're doing a lot of great things. You're learning how you wash your hands, you wear a mask when appropriate, and you are kind to others. So is that something that parents can model and put forward for their children? So as parents are thinking how they're coping, think about that their child is watching every little thing. So even if you may not totally agree with what the school's doing, that can be something that you have in a conversation with adults, but children need to see that you're supporting however they need to learn right now.
Absolutely, thank you. And as somebody who can't even juggle balls, I'm certainly not about to tackle chainsaws because I need all the fingers that I have. Okay, thank you, panelists, for those opening answers. That was terrific. We're now going to move on to questions. So for all the reporters on the call, you can type a question in the Q&A window that I can ask, or you can raise your hand in Zoom so that we can unmute you and you can ask the question yourself. If you're calling in by phone, you can raise your hand by pressing *9 and we can unmute you and you can ask your question that way. Just a reminder to our panelists to identify yourself whenever you start answering a question. So I'm going to move right in. I'd like to come back to you, Professor Straumann. And you mentioned one of the big causes of stress through this pandemic has been the lack of control that people feel, because obviously we have no way of controlling the larger situation. What are some of the ways that people can take back a semblance of control in their personal life to maybe help mitigate some of those feelings of being helpless in the face of everything that's going on?
Well, I have to say I was very encouraged to hear all three of the other panelists basically already talking about this and answering the question. You know, there's a difference between sort of saying I personally myself am responsible for fixing the problem, dealing with it, versus I'm one small part of a solution, but I can still be part of a solution. And I think, you know, each of us can look into our daily circumstances, acknowledge the things that are truly uncontrollable, but still find ways, like Dr. Gervich was talking about, for ourselves, for our family members, to say, you know, here are some choices we have. Let's make choices that allow us to feel like, in some small way, we actually are part of the solution. We're not making the problem worse. You know, we're wearing masks. We're sort of protecting ourselves and other people. We're choosing wisely among a set of options which may not be terrific options. So the uncontrollability is something that produces a lot of chronic stress reactions, like Dr. Bourassa was talking about. You know, our bodies start to churn out stress hormones. And when we're under circumstances that feel uncontrollable, our nervous system is finely tuned to say, okay, we've got to be at our best. So the adrenaline starts pumping, you know, something may happen at any moment. And that's great in an acute emergency, but it's really toxic over a long period of time. And so I think anything we can do to reintroduce some controllability, even if there's seemingly trivial choices. Today, I'm going to reach out to somebody that I otherwise wouldn't have reached out to. Or, you know, today I'm going to take 10 minutes and just sit in a quiet room and do a little bit of breathing and allow myself to get a space. Anything that introduces controllability is a way of sort of reminding our nervous system that we're okay. We're going to be okay. Thank you, brain, for reminding me that we're in a crisis. I'll take it from here.
Gotcha. Thank you. And following up on that, Dr. Bourassa, I'd like to ask you. You mentioned about the indirect effects on health and the need to eat well and to exercise. We also know that at times of stress and anxiety, excuse me, it's easy to slip into being listless or not wanting to do those things. What are some simple kind of tricks that people can do to try and keep themselves on track, to get themselves on track, to pick up a bag of salad rather than a bar of chocolate in the grocery store? Not that I've ever done that.
Yeah, so
chocolate.
I think the one of the simplest ways is to create sort of daily routine and daily lists. I think you've heard that mentioned by other members on the panel as well. Something as simple as, you know, every time that I'm going to brush my teeth, I'm going to do something else at the same time. When we pair activities or things that we do every single day with things that can help us in our health, it's a little bit easier to follow through on them. I also think it's really important to not get too focused on what I would ideally like to be doing if, say, the pandemic wasn't going on, and instead thinking about what realistically can I do that's going to help move me in the direction of, my values. And in this case, if that's going to be something like health, can I go do 20 push-ups, or can I walk around the neighborhood? Yes, maybe you can't go to the gym or lift weights or do the kinds of things you might want to do in terms of exercise, or maybe you can't go to the grocery store as often as you would like to. But what are the small things you can do that are going to move you in the direction you want to go? It can be very easy to get caught up in this idea that I can't do things exactly the way I would like to. And as a result, kind of just deciding to blow it all off as a result.
Oh, absolutely. Thank you. Professor Gassman-Pines, I don't want to be too apocalyptic, but the figures you cited in terms of the 50% of working parents dealing with some form of anxiety or depression is obviously pretty terrifying, even though I think so many people can identify with that. What, again, I mean, this sounds obvious, if we get it in your words, what are some of the things that makes you worry about moving forward? Because we know that we don't know what the end of this situation is. There will obviously be a long financial hangover, especially for more vulnerable populations. When we look at the situation that you're seeing now in your survey results, what does that mean for the next few months and year? What are the things that you're most worried about in terms of that as a trend?
Thank you for that question. So I think there are a few key points to make here. And to follow up on my fellow panelists' really important points about individuals and taking care of their own health, it's really important to remember that for these hourly service workers, a lot of them being essential workers, they were in a situation even before the pandemic where a key part of their adult life, being their work, was often very unpredictable and out of their own control. So even back in the fall of 2019, before this pandemic started, we were already seeing that there were regular changes in people's work schedules that happened at the last minute and that were completely unanticipated. And one of the things, unsurprisingly, that's happened during this pandemic is that those work schedule changes have nearly doubled in frequency. So this could be getting a shift cut short, this could be getting a shift canceled altogether. And when you don't know when you're going to be working or for how long, that's creating a tremendous amount of additional stress for these families, not only because they lack control over their work schedule, but also because for hourly workers, if they don't work, they don't have earnings. And so it also has serious implications for families' financial well-being. So that's point number one, is that for a lot of the essential workers who we've been hearing a lot about during this pandemic, things were already in many ways very unpredictable and unstable before, and this pandemic has worsened that for them. The second thing is that the policy supports that were in place during the really acute phase of the crisis have gone away now. And so this includes, for example, the pandemic unemployment compensation. So for individuals who aren't working anymore, which in our sample is 36% of the sample is now unemployed. Initially, Congress had passed this expanded unemployment compensation, which was quite generous and meant to support families' financial well-being, but also to support the economy, because those dollars tend to get spent right away, at grocery stores and other essential businesses in ways that also support the economy. But that support, as well as the one-time payment to families, have ended, and that's also increased families' financial strain in ways that is connected to their mental health.
Sure, absolutely. Professor Gerwich, I'd like to come back to you. As we think about the children, in these situations and other situations, one of the things that I've noticed as a parent is that one thing that children have really been starved of is the company of other children. They're not able to play with their friends, and as much as we might try to be good playmates as parents, there's only so much that a parent can do. What are some of the things that you could suggest to parents as ways of helping children cope with the isolation from other children? And I realize there's no magic wand here. But.
Oh, I know. I wish there were a magic wand. So one of the things to recognize for parents, and I want to go back to what Dr. Gassman Pines was talking about, is the stress that they are under. And it's unfortunate, but it's realistic. Parents can't turn in their parenting manual to chapter 5, how to help my children during a pandemic. It just doesn't exist. So a lot of what parents are doing is trying their very best. And as they think about how can I increase the peer relationships, because it's, you know, the littles all the way up through teen years, those social relationships are incredibly important. So it may be thinking through, how do you want to do Zoom? I've had kids where one 5-year-old has their Legos and they build something really cool, and the other 5-year-old has their Legos, and then they meet online and compare their Legos creations. So helping think through something, some new ways to make those connections. It may be when you take a walk, can we socially distance and each put sidewalk art out? It may be with teens, thinking about, can we socially distance but be together in a small group. I think for teachers too, helping to recognize that on top of all of the academics they need to do, part of what they're going to be doing in this new world of learning is thinking about how to create small group activities, how to promote exchanges between students to increase those social opportunities. But this is really where we get creative. This is where we also include children. I think, you know, for children during the drive-by birthday parties have really been wonderful, that children can think about what signs they want to make to hold out as they drive by a friend's house and honk their horns and wish happy birthday. So include your children and your teens in discussing how you may want to be together, and recognize and validate that they are feeling disappointment, they are feeling frustration, they may be angry that that's not happening the way it was before, and validate those feelings as they think of new and creative ideas.
Sure, thank you. Lots of good suggestions in there. I'd like to remind everybody on the call that you can ask questions directly via the Q&A window if you like, or you can raise your hand in Zoom so we can unmute you. And if you're joining by phone, you can raise your hand by hitting *9. We'll move on. I'll come back to you, Professor Straumann. Following on from Professor Gowich's remarks about children, parents, even parents who aren't in the vulnerable situation that Professor Gassman Pines has discussed, there are millions of parents right now who are trying to work from home and trying to homeschool their kids as best they can. And some of those parents might find themselves in a moment where they're getting barraged with questions and they're trying to work and they feel extremely stretched, you know, in so many different directions. And, you know, in those moments, we can kind of lose sight of the best ways to remain patient and calm. What are some direct suggestions you might have for people, you know, something quick that people can grab for in a moment when they feel utterly overwhelmed and just need to kind of refocus?
I'm going to say something very simple, and I'm going to also confess that I'm not very good at it myself. Stop and breathe and just let a few seconds go by. I mean, if you think about it, it's just hard to work from home effectively. And it's really hard for those of us who aren't trained as educators to educate. And it's really hard to be doing, you know, childcare. And it's impossible to do all three of those things at the same time. You're simply not going to be able to do them well, which is very frustrating. It gets people down. So family and friends of mine who, let's close your ears for a second. I'm just going to say what I should be doing, and hopefully what other people can benefit from, is literally just stop and take a breath. Sometimes it's the most effective thing we can do. It gives our conscious mind a chance to say, okay, what's happening here? I have some choices in how I want to respond to this. I can go with my gut reaction. Maybe that will be a great thing. Maybe it won't. Maybe I should spend just a few moments contemplating. That's not easy when your boss is in one ear and your family's in the other ear and you're trying to pay attention to something on Zoom. But I think sometimes it's a simple and easy to implement antidote to the kinds of chronic pressures that I know people are feeling.
And
Absolutely.
if I
Sorry, go ahead.
can build on that, when your children see that you're practicing that breathing, and you may include them on how to breathe too, that is great all the way around. But to recognize and to give yourself a break, we can only do what we can do. And there are going to be some great days, and there are going to be some, oh, I could have done this better days. But when we think about it, to recognize those 8-hour work days, 10-hour work days, those just are not going to happen anymore on Zoom uninterrupted when you have children. And so how can you chunk your time a little bit differently? Think about, for children, that you may set a timer for 90 minutes and let them know that I'm going to do my work for 90 minutes, and let's think about what you're going to do. And when it goes off, seriously, take a breath, get up, go engage for 10, 15, 20 minutes with the child before you come back again. Think about realize that young children, actually children of all ages and adults, we're struggling with attention and focus right now. And so children are going to need a little bit more help than they did before. So how do you build that help into your schedule? But helping children recognize that I'm going to go do this, but I'm truly going to come back and be with you too. And it's not in 4 hours, it's in a small chunk of time.
Sure, absolutely. Thank you both for that. And as Mr. Miyagi said in the 1987 classic Karate Kid Part 2, no breathe, no life. So yes, indeed, breathing, we should all remember that. Dr. Bourassa, we've had a question come through for you. You mentioned earlier pairing desired behaviors with routine behaviors as a strategy for coping with this thing. Could you give us some more examples of that?
Yeah, so I can give a sort of a personal example. You know, for me, exercise is one way that I use to cope with stress and to also stay fit and healthy. And at the end of my work day, I go for a run. You know, it's 15 minutes. It's not a huge amount of time. I get my shoes on and I go. So for me, the end of work is being paired. That's something that's going to happen every single day, hopefully, is then being paired with something else like running. For other people, that might be something like, you know, when they wake up in the morning, the first thing that they're going to do is they're going to work out. I'm not someone that likes to work out in the morning, but that's one thing that other people have found helpful. For others, maybe it's something like they set a little reminder for themselves when they're going to the grocery store, and that reminder pops up and tells them, you know, focus on buying more vegetables, or, you know, buying more fruits or healthy foods. I focus on exercise quite a bit because that has benefits for both health, in terms of your physical health, but also mental health. But you can think about any of those health relevant behaviors. So things like making sure that you have notifications that are coming up in terms of, you know, when you need to go to the doctor, when you need to take your medications. And even taking medications can be a time where you're able to remind yourself to do the things that you need to do. Whether that's, you know, getting ready to wind down at the end of the night to go to bed, or something else. It's a little hard when you don't know the exact behavior that you want to pair, but thinking about something that you're going to do every single day, and then making sure that you're remembering, okay, when I do X, I'm going to do Y as well. Then it can essentially become ingrained, and you're doing something every single day anyways. So pairing that with something that you're trying to then do every day is one way to essentially tie those two together and start a new habit.
Sure, absolutely. Thank you. We've had a question come through for Professor Straumann, and I'd also be interested in everybody else's take on this too. We're seeing addiction rates going up at the same time that in-person lifelines like AA meetings and outpatient treatment programs aren't always accessible to people in an in-person way. You know, millions of people depend on those kind of meetings to get through. What kind of opportunities are available for people in those situations? What can we do to help people like that? And what kind of concern does that give you? You know, that this kind of in-person treatment is not always available in the way it has been at a time of great need.
Well, I mean, the fact is that long before the pandemic, we as a society were not providing sufficient support for people who were dealing with different kinds of addictions and mental health problems. And that's clearly just gotten worse. One of the things I will say that I've encountered professionally as well as personally is that when a meeting can't occur, people are still finding ways to make smaller connections. You know, so even if you can't get together with a group of people that you trust, that you know will validate, you know, what you're going through, maybe you can connect with one of those people. And in fact, maybe even if you're not feeling particularly stressed on a day, you can reach out to somebody and see how they're doing. We don't have to lose those connections. There are real constraints on what we can do. There also are an extraordinary range of professionals who are making themselves available for what is essentially crisis duty. And I know the various psychiatric, psychological, social work associations in North Carolina, for example, all have made available people who are licensed professionals who say, you know, I'm here for you. This is not going to involve billing. It's going to be confidential. There are a lot of things we can do. The pandemic, and this relates to what Dr. Gassman-Pines was talking about, economic instability. The pandemic has really highlighted ways in which we are not taking care of ourselves as a society. But it also is highlighting there are things we can do, and I think a lot of those come down to maintaining individual contacts with people we trust, or people we assume or are wondering might actually need somebody reaching out to them. So it goes both ways.
Sure, absolutely. And Professor Gassman-Pines, I wanted to come back to you on that. You know, you mentioned at the beginning these high rates of depression and anxiety that you were seeing in people in your survey. Do you have any sense as to whether people are getting connected with services that can help them with that, or if those services are even, you know, exist where these people are, that there's any kind of help out there for them?
So we haven't asked them specifically about their ability to access services, but just to follow up on Professor Straumann's point, for low-income folks in the United States in particular, but for all of us, mental health treatment was already difficult to access before the pandemic. And this pandemic has now increased need across income levels and also challenged service delivery in a lot of ways. And so I think a key thing for all of us to be keeping in mind as we move forward is to really be thinking about, in addition to maintaining those individual connections, as Professor Straumann mentioned, which I think are crucially important, also to be thinking about where we want to be investing in the future. Can we be thinking about transforming our mental health system here in North Carolina, for example, and in states across the country, and thinking long term about really investing in supporting our, the mental health of people in our communities.
Sure, thank you very much for that. We've had another question come in, and Dr. Bourassa, I'm going to go to you first, but then Dr. Gerwich, I would definitely like to get your perspective on this too. And it's a question about the role of sleep. You know, we know that obviously getting good sleep and getting enough sleep is key to physical and mental health. But it seems like during the pandemic, you know, with the anxiety that it's causing is interfering with good sleep for a lot of people. How big of a problem do you think that is right now? And what are some of those kind of simple time-honored techniques that you would remind people to use to ensure they're getting enough rest?
Yeah, so I think I'll cover a couple topics there. First, I'll start with sleep hygiene. So this is something that we frequently suggest, and you can look up online, but essentially it's just making sure that the environment that you're going to sleep in is as conducive to sleep as possible. So these are the things that people have probably already heard of, you know, making sure that your bedroom is dark and quiet, and that, you know, you're not being disturbed either by light or, you know, having something like high temperatures or high humidity can be difficult. Trying to avoid caffeine later at night. So try not to have any caffeine after, say, 4 p.m. Some people are more or less sensitive to things like caffeine. And essentially just trying to build in routines so that people can wind down before they're getting ready to go to bed. Now, I'm going to say straight off that a lot of people have tried all these things, or they simply can't control those things in their environment. People with young children, people who live in loud environments, in urban environments where maybe things are loud. You can't necessarily, or actually, sorry, I should mention too, shift workers, right? If it's going to be extremely bright, we know that shift workers struggle with sleep and health as well. So looking up how you can move in the direction of having some level of sleep hygiene can be very helpful. But I'll also put a plug in for cognitive behavioral therapy for insomnia and sleep restriction, which are techniques that have been developed over the last several decades and are really effective to help people who are struggling with insomnia or not being able to get enough sleep. The idea between both of them, and I won't be able to get into the full idea, but it's supposed to essentially limit the amount of time that you're spending in bed where you're tossing and turning, wishing that you could sleep, and instead restricting the time that you're spending in bed to just time when you're asleep. For a lot of people, they're using phones in bed, or maybe watching TV, and essentially the idea is that that's pairing the idea of our bed with being awake and being engaged with something. So rather than being on something that's supposed to keep you awake, like a phone, maybe putting that away or only using your phone when you're outside the bedroom can be very helpful. Again, I won't be able to get into all of sort of how those treatments work, but the important thing is they're really effective. They're some of the best treatments we have, and I would highly encourage people who are really struggling, going ahead and Googling something like sleep restriction or cognitive behavioral therapy for insomnia, getting support if they feel like they need that, and looking into sleep hygiene as well. These are all things that could be potentially helpful for sleep.
Thank you very much for that. Professor Gerwich, I'd love to hear about this from your perspective with children, especially as they're adjusting from maybe sleeping in a lot during the summer to now getting back into schooling.
Absolutely, and add the stress. One of the things that we see in children of all ages, when they're stressed, sleep takes a hit. Whether it is going to sleep or staying asleep, sleep takes a hit. And if children aren't sleeping, then their caregivers are not sleeping either. And so I would absolutely recommend, just like was discussed with adults for sleep hygiene, a routine with their children. So do you have a set up time for when you go to sleep and when we get up? That's important for children as well. Do you do something that's calming before? So rather than watching a horror movie right before bedtime, are we doing something that's more calming? Are we, for young children, are they getting a story and then we turn off the lights and they can go to bed? With teens, absolutely helping them recognize the impact that checking their phones constantly has on their sleep. There's a lot of data about teens and anxiety and worries and increase in mental health problems because of I can't be away from my phone for 5 minutes. So helping them create that sleep hygiene as well. With children that are truly struggling right now, with young children, they may even be struggling with sleeping by themselves or sleeping alone. And so for parents, one of the things that we can consider is, as they get into bed, to let them know we're really proud of them for getting in their bed on time. I'm going to go do the dishes and I'm going to come back and check on you. So in 15 minutes, walk back in. If they're still awake, let them know you appreciate that they've stayed in their bed, and you're going to go fold laundry and you'll check on them again, and you'll increase the time. But the child knows that somebody's going to check on me, that I can count on that. And it'll make it a little bit easier for them to fall asleep. And in the morning, I think it's important also to acknowledge, I am so proud of you for staying in your bed last night and getting a good night's sleep. That's going to help you learn. That'll help us get along better. I'm going to try and get good sleep too. So again, setting up that sleep routine for children, that sleep hygiene is as important for children as it is for adults.
Absolutely. Thank you both very much for that. Just another quick reminder to our reporters on the call that you can ask a question in the Q&A window, or you can raise your hand in Zoom, or hit *9 if you're joining by phone, so that you can raise your hand that way. But we've got a little bit more time, so there are some more questions that I wanted to get through here. And Professor Gerwich, I actually wanted to stay with you. One of the situations we've got now, especially here in North Carolina, is that there are many children who are going back to school, but some who are doing all virtual learning based on whatever the parents have decided is best. But that also requires parents have to explain to some children why they're going to school and why others are staying at home. What are some ways, especially with younger children, that you can talk to them and help them understand why the situation is the way it is?
I think that's a great question, and there isn't a one size fits all. And as we're finding, schools may start with this plan and then they pivot within a week to a different plan, which can create an increase in anxiety and worry because of that uncertainty about what's going to happen. But what we need to think about and what parents need to remember is that as adults, we need to support whatever choice we're making for our children. So if the schools are saying we're going to do virtual learning, then parents need to support. We're going to do virtual learning. I can talk to somebody else later about how much I need my kids in school, but their children shouldn't see that going virtual is a bad thing, or else they're going to approach it because they don't want to negate what their parents are saying. But helping children, talking to them, there's lots of different things that are happening with the school. Tell me what you know about it. That allows you to hear what their perceptions are around the choices of going to school. And you may hear things that are absolutely just not even in the ballpark of what's accurate. But you have to start the conversation and ask them what they know about it and what they think about it, how that feels. Secondly, I think it's important to talk to children about, we've made this decision. Let's talk about why our family made this decision and what that's like. So it may be that we made the decision to stay at home because we interact with our grandparents and we're worried about their health. It may be because we're worried about your sister who may be ill. We made this decision and we may change it later. So it's not a decision that's for always, it's the decision we've made for now. And so talking with children about the reasons you made the decision and how you support that decision, and acknowledge some of their disappointments maybe around the decisions, or their anxieties or worries around the decision.
Sure, that makes.
I'm going to just finish my thought real quick, but helping them think about what kind of control they can take with whatever choice is being made. I think the panelists have all talked about that. COVID has taken away our sense of certainty and control, and that leads to anxiety and worry in children too. So what's something they can control, and how can they be part of those solutions too?
Sure, that makes sense. Thank you so much. Professor Straumann, I'd like to come back to you. When we talked at the beginning about the different kinds of stress that this caused, you mentioned about there being no end in sight. And I think most people who have been working from home or not working, or even going into work in this situation, it's affected everybody's perception of time. It seems like the weeks fly by, and yet it's been so long since this thing started. Are there any things you can suggest in ways that people can think about time? Because we look forward and there's so much uncertainty. We don't know if we have to wait for a vaccine, or whether we're going to go back to normal, or whether it's going to be a new normal. But when we think about time and the future, are there certain ways that we can trick ourselves into thinking about this to maybe not focus so much on the apparently currently endless, no end point in sight nature of this thing, and to maybe keep us more focused on smaller units of time that we're experiencing right now? I know that's kind of out of left field.
Well, that's a great question, and I wish I had a magic bullet answer to it. I want to just return to the idea of what can we realistically control. No matter how much uncertainty is around us, and this is something that Dr. Bourassa mentioned that I really want to second. We have values as individuals, and we have values as families, and those are the things that guide us when we make our decisions. Like Dr. Gervich is saying, the reason we as a family have decided you kids are staying home for now is because of X. Those values can really be a touchstone at a time when so much else is unpredictable and out of our control. And a lot of those values are actually tied to how we live on a day-to-day basis. When we get up in the morning, what is it we really know we want to accomplish? Maybe it's, we want to help somebody in our family get off to work. Maybe it's, we want to help create a peaceful environment for somebody else. Maybe it has to do with health. Those are kinds of things that allow us to create a schedule, allow us to create a reasonable set of expectations for each day, and then be able to look back and say, okay, in the pre-COVID era, this would not have been a productive day. But under COVID circumstances, I did a really good job today. I took care of my family. I took care of the people that I love. I really was part of the solution. And And I actually want to give a shout out to the essential workers who allow us to do those things and who have been so under the radar, underpaid, underappreciated. Say thank you to people who are, helping you check out at the grocery store, because that gives you a sense of certainty. You were able to go to the store. You were able to, buy the food that you need, and it gives them something too. But I think a lot of it is our values tell us what we want our day to be organized like. And if we organize our day around our values, it's not going to seem like time is slipping away uncontrollably. It's going to seem like, yeah, there's still a lot of uncertainty in this future, but I made today as good a day as it could possibly be under the circumstances.
If I can follow up, because Dr. Straumann made just an incredibly important point for where we are right now. I heard somebody recently refer to it as we're in the normal for now, because it's going to be a different normal tomorrow, perhaps. This is an opportunity that families have to think about what kind of values and beliefs they want to share and instill in their children, and to think about this as a seminal moment for that. So I am hopeful that perhaps we come out of COVID as a kinder nation, that our families have thought about and instilled a sense of kindness or gratitude, that we do model saying thank you to our essential workers, whereas before maybe we didn't. So this is an incredibly important time for families to really step back and think about what are the values, what are the beliefs, what are the actions that we want to promote in our children, model for our children, and have for them. And to recognize that we are dealing right now not just with COVID, but our country is also dealing with all of the racial disparities and all those actions at the same time, which are extremely stressful too. So it's that intersection right now that for many families is causing more stress and distress. So again, what are the values that we want to help our children learn and gain? So when we do move into whatever the next normal is, those values and beliefs will come with us.
Absolutely.
And if I could just build on that as well, because these are very important points. And I do think that the pandemic has really helped people crystallize their thinking about their individual and their family's values. But I would also like to expand that to us thinking about the importance of our collective values as a society. And so one example of that is we have, as a society, through our elected representatives who are meant to reflect our collective values, in many cases made it quite difficult for vulnerable workers and vulnerable individuals to access social services and public supports. We have done that by choice, with the value that only the absolute neediest should gain access to these publicly provided services and supports. In reality, the way that tends to play out, though, is that individuals with more resources who can navigate a complex system with many barriers built in are the ones who are able to actually obtain those services. And we leave out the very neediest who need our services the most. We've seen that play out right here in North Carolina with our unemployment insurance system, which had been set up to be burdensome and difficult to access. That is a reflection of our societal values. And I think in this moment, in this pandemic, where we've seen, for example, here in North Carolina, what that has meant for workers who have been laid off, how difficult it has been to access those services to which people are entitled, I am hopeful that this might cause us to collectively step back and think about these societal values and moving forward, whether we want to make services, for example, easier to access, to set up structures that are less burdensome, so that more members of our community, when they're in a crisis and in a time of need, are able to access services that they are entitled to.
Thank you very much for that. Certainly, there's no magic bullet, but it seems like empathy in government could go a very long way to at least getting started solving some of these problems. And Professor Gassman-Pines, I wanted to stay with you. You study maternal health, and certainly we know that when it comes to homeschooling and just bearing the brunt of a lot of work that happens in the home, that disproportionately falls on women and mothers. Are there particular, we've discussed a lot of the findings of your research, but are there particular concerns or worries or things that we should be thinking about in terms of the burden that this is placing specifically on women and mothers at this time of stress?
So that's a great question. And there are a few points that I'd like to make. The first is that it doesn't have to be a given that women are the ones burdened with caring for children and doing this juggling act. That's also a value we've chosen societally, but we don't have to be making that choice. We could expect more of fathers in terms of doing this kind of care work. So that's an important first point. The second is that in terms of especially essential workers who we've been talking about during this briefing, I think it's really important to recognize that essential workers are the ones who actually have to go outside the home to do their work. So nurses' aides have to leave their home to go care for elderly and ill in our communities. Grocery store workers that we were talking about earlier, that's not work that can be done at home. And so when we think about supporting these essential workers in getting their work done and also being caregivers, that broadens the question out to be thinking more holistically about childcare and other supports for families with young children. If I am extremely privileged that I am able to continue being a Duke University professor from my home, while also co-supervising the care of my children. But many workers are not able to do that. And if they are going to be able to pay their bills and pay for the basics like rent and food, and this is the stuff that folks in our survey sample are talking about. They're talking about focusing on being able to pay for rent and food. Then we really need to be thinking societally, bigger picture about our childcare system and how our childcare system can be supporting these crucial, essential workers at this time.
Sure, absolutely. Thank you. And Professor Straumann, I wanted to come back to you on this notion of essential workers, because you touched on it earlier. And obviously there are a whole different additional set of stressors for essential workers, frontline medical workers especially, and nursing home workers right now. They're facing the same thing that everybody's facing in terms of the uncertainty and the worry and the long-term nature of this. But then, of course, they're also risking exposure to go and take care of people and to help the sick, sometimes people who are specifically sick with COVID. Are there any particular things you could say to people in those situations who are experiencing maybe even more worry and less of control than others? And I don't know, techniques that people like that, things like people in those situations should bear in mind that can maybe help them when they're suffering from, in many ways, more stress than everybody else?
Well, thank you for that question, because I think those people especially deserve to be recognized. First of all, understand how much the people that you're taking care of appreciate what you're doing, which was always true. And we probably underappreciated all the way along. And especially now, it gives us an opportunity to say, what a blessing these people are and how courageous they are for doing what they're doing in the midst of a pandemic. All of the things that we've been talking about in terms of stress reduction, I think are important. I know here at Duke, for example, there has been a real concerted effort to help provide additional supports for the people who are on the front lines. It's not easy for those of us who like to think of ourselves as resilient and tough and we can handle anything that comes along. It's not easy to say, yeah, actually, that sounds like a really good idea. I could use that. And so as a healthcare professional, I want to encourage other healthcare professionals to remind themselves that, self-care is where everything else begins. The way that I can be effective as a healthcare provider, compassionate as a healthcare provider, is I've got to be somewhere near my best. And so that really is where it starts. And, you know, and that's how we live up to our values, and that's how we, you know, do the jobs that we do, and that's how we make a difference in our community. So I want to encourage people who are healthcare providers and essential workers to, you know, use what's there. Don't be shy about using what's there. It's not an admission of weakness. It's a sign of strength. It's a sign of maturity. It's a sign of wisdom. It's a sign of insight. And our families, our kids, our neighbors, they see it. They see us modeling, you know, how can you best cope in a pandemic? So again, I mean, I think it's important for all of us to say thank you and to remind these people that, you know, the services and the supports that you have access to, please take advantage of them.
Sure, absolutely. Thank you. We're getting close to time. In a moment, I'm going to come back to all of our panelists and ask them for one thing that they would like working people, parents, anybody to kind of bear in mind, help them get through this. But before we do that, Dr. Bourassa, I'd like to come back to you. You've talked a lot about values and about arranging our day in ways to keep us healthy. But one of the things I want to ask you about is this element of fatigue. I found, and I'm sure I'm not alone, that back in the spring, I was riding my bike every day. I was eating more healthily. But now I find a few months later, it's hot. I'm not riding as much. I'm picking up way more ice cream than I was a few months ago. So what kind of suggestions can you give to kind of acknowledge that fatigue and maybe kind of steer around that when, at the risk of sounding flippant, like I start to find that one of the values I organize my day around is getting some ice cream, like ways to kind of, you know, get yourself off that track and onto this healthier track when you're feeling a bit of fatigue about it.
Yeah, so that's a great question. I think, you know, I do wonder if your value is really about ice cream specifically, or about maybe enjoying eating something that's important to you. But, you know, that can be ice cream, that can be all sorts of things. And I think that taking a step back is one of these things. When we start to notice that we're sliding, for some people, maybe that's they've gained a little bit more weight than they're comfortable with for their, you know, their level of health or what they're comfortable with. They're not exercising as much as they used to. They start to notice that they're just, you know, they're not getting to sleep on time, and, you know, not getting the kind of rest that they wanted. When you notice that, that's a time to stop and just say, okay, let's take a step back. Let's look at what's going on. It doesn't mean that you're, you know, you should be blaming yourself for these things that, you know, you're doing wrong, but it's a time to, you know, change your direction. I always highlight for people that are going through challenges like trying to lose weight or trying to exercise more, or any of these health behaviors, they're really hard. I mean, if they were easy, people would just be doing them. We wouldn't have to have these conversations or these kinds of panel discussions. So acknowledging that and then saying, okay, how can I think about this as sort of a marathon, not a sprint? When you start to see that, okay, things are changing, what are the small changes I can do to get back on track? What was I doing differently before that I can change now? And reminding yourself, why are you doing those things? You know, I mean, eat ice cream, but, you know, in the end, if that's what's important to you, that's important to you, right? You know, there might be reasons why that's not going to be healthy, or that's not going to be, you know, doing the things that matter to you, whether that's, you know, I've talked about losing weight, or maybe that much sugar before you go to bed, something like that isn't going to be valuable. But, you know, having an honest discussion really with yourself, or, you know, bringing in someone that you trust to maybe have a conversation about it as well. You know, why do the things that matter to you? And I think that can really provide people with a reinvigorated sense of why these things matter to them. Not because, you know, it's going to, you know, necessarily make them feel better, which hopefully happens, but also because it's just important. It's something that we sit there and we say, this is something that matters to me, and that's why I'm doing it.
Absolutely. So, thank you. That's extremely valuable. And of course, I wasn't talking about me when I was talking about ice cream. It was just a hypothetical other person who eats too much ice cream. Okay, this has been fantastic. We are about at time. I would just like to go back through each of our panelists and give you one quick opportunity to say something that people, be they working people, parents, anybody else, should be bearing in mind to help them get through this. And Professor Gurwitch, I'd like to start with you if we can.
Sure. Again, thank you for having me. This was, I truly enjoyed this discussion. I think if I had two things to close up, one would be, please talk to your children. They need to be talked with, not talked at. They need to be included in the conversation. Science is very clear when we talk to even young children about difficult topics, things are better in the long run. So A, talk to your children, and B, recognize that you are an essential role model. So think about, how do you want to model for your children, everything from sleep hygiene to breathing to eating to coping with some of the uncertainty and making connections. So those two pieces, I think, are critical to families and our society moving forward.
Thank you. Professor Gassman-Pines.
Thank you so much for having me. My message is actually to a particular group of working people, and those people are members of Congress. It is within their control to pass additional legislation that will help working families during this crisis. That includes revisiting expanded unemployment compensation for individuals who have been laid off as a result of this pandemic. And it can also include other ways of providing economic support to vulnerable families, like making the Supplemental Nutrition Assistance Program more generous. Those dollars help families and children cover their basic needs, supporting families' economic and psychological well-being, and also provide broader supports to our country's economy.
Thank you very much. Dr. Bourassa.
So 2 main points. I think, first of all, just really trying to connect with people, the people that matter to you most, however that might work. We call it social distancing. That's the term that's been used for decades in research, but it's really more about physical distancing. So don't think about having to be socially distanced from the people that you really care about. Connecting with others is good for your mental health. It's good for your physical health. And it's something that that's been shown in research that I've done and numerous others have done over the past several decades. And the second point I'll just say is, if you or anyone you know is struggling, maybe they've talked about hurting themselves or hurting someone else, just know that there are crisis resources out there. In the state of North Carolina, there's a great crisis website that gives you connections to behavioral health treatment or options in your local environment. That's going to be true really for any state in the country. So go ahead, use Google, use those resources, and know that 911 is always available if someone is having a really tough time.
Thank you very much. And Professor Strauman.
Yeah, thank you so much for the opportunity to share. It's going to be a bumpy ride for a while. And as an individual, there's not much you or I can do about that. And our bodies are responding that way. They're giving us a very clear signal. Things are not right. Things are demanding our attention. And what I'd like to leave people with is see the signals, appreciate what your body and your nervous system is telling you, that this is not a normal time, and then stop and say, how can I find a balance that will work for me and for my family today? Even if it's not an ideal balance or one that, I want to have a year from now. So let's, read the signals, appreciate where they're coming from, take them seriously, and then find a balance that's the best we can do under these circumstances so we can take care of ourselves and ride out this period.
Thank you very much, Professor Strauman. I can't think of a better note to end it on. This has been terrific. So much valuable information here. I hope everyone has found it helpful. We'll call it there. Thanks to all of our panelists, Robin Gerwich, Kyle Bourassa, Anna Gassman-Pines, and Tim Strauman for sharing your perspectives. Next week's briefing is on North Carolina's role in the November election, which of course will be taking place in a pandemic. Lots to dig into there. If you'd like to attend that event, please email dukenews.duke@duke.edu. In the meantime, please stay well, remember to breathe, don't juggle chainsaws, and put down the ice cream. Thank you very much, everybody. Stay safe and have a great day.
Bye. Thank you.
Thank you.
Thanks, everybody.